Everyone. Thank you for joining us today. We are here for the bi-weekly COVID situational assessment and update. Very pleased to have you all with us today. Just making sure everybody has the correct information. I've got a couple of notes coming in from those needing the link. But I'm seeing people sign in now, so I think we're in good shape. Okay. So it's March 3rd. Let's start with a land acknowledgement. Take a moment to express our gratitude for living in such a beautiful part of the world and such a wonderful country. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, and I understand that our Board of Health Chair, Mayor Mitchell, is waylaid a bit with the County Council meeting, so we will invite him back to share his comments later in the event. So let's start with Dr. Piggott to lead us through the situational update. So go ahead, Dr. Piggott.
Thank you so much, Brittany, and good afternoon, everyone. Hope you're doing well today. And I'll start discussing a little bit about the tracker and some of the current COVID context. Let me just pull up the right document here. Perfect. Okay, so as you can see here on our slide, the first slide is just showing our vaccination program rollout. And you can see that rates are increasing, but have been increasing more slowly now. We've administered just over 2,400 more doses since 2 weeks ago. Locally, for those who are eligible now for a booster, which includes 12 years and older, we stand at just 54%. So we're up about a percentage from 2 weeks ago, which is good, but still lots of progress to go on that third dose. On to our next slide, you can see specifically in youth, the vaccination rates are showing stronger growth than in adults, but they've been slowing. Over the last 2 weeks, doses have increased only 6%. So now 35% of local youth 5 to 11 have received both doses. And vaccinations among youth 12 to 17 are looking good. And it is great to see that 11% now have taken advantage of the third dose for that enhanced protection. And again, that is recommended for all in that group who have met the interval and are due for their third dose. It is important protection, especially against infection, for protecting those around you and yourself. On to our next slide here, you can see the number of PCR lab confirmed cases has decreased slightly, down 19 cases from 2 weeks ago, and we're now at 175 confirmed active cases. A reminder with our iceberg picture here, it's really just showing the tip of the iceberg because of eligibility criteria for testing, and these are again PCR confirmed tests. The number of local deaths that we've seen has increased by 3 since our last briefing. Sadly, we've had 3 additional deaths in the last 2 weeks due to COVID-19. As you can see here, the incidence as well remains quite high, and in Peterborough higher than the Ontario average. Last week in Peterborough it was 115 cases per 100,000. And last week in Ontario was 83 cases per 100,000. The incidence has actually increased a little when you look at the number compared to 2 weeks ago. That's just artifactual because incidence looks at a full week, and the number of active cases, which is decreased, is actually a point in time. So we're looking at active cases as of today, whereas an incidence looks at a period of time. On to our next slide, you can see here a little bit of information on hospitalizations with, again, a decrease down to 7 from 8 hospitalized cases at our briefing 2 weeks ago. So that's, again, good news, and good news that there are no active outbreaks at the hospital. On to our next slide here, you can see we are at 1 less outbreak than we were 2 weeks ago, down to 5, but we continue to see outbreaks, especially in those higher risk settings, long-term care homes and other settings, and they continue to be really important to help to control in order to prevent the spread of COVID-19. On to our next slide, I'm going to show you briefly some of our wastewater surveillance data, and you can see, looking at our Peterborough sampling sites, really a plateauing. We had that increase to a peak in early January, and you can see the levels haven't petered off to the levels they were before the peak started in December. They still remain very high, which signals still quite a lot of transmission in our community of COVID-19, but a much bigger, much better place, a much lower rate than where we were several weeks ago into the thick of COVID-19. On to some of our other sampling sites in Lakefield, you can see there has been some increases, but now recently a slight decline, which is good and encouraging, but a reminder among all residents in our region that there is still transmission occurring, and vigilance with regards to protections against COVID remain important. In the Millbrook sampling site, you can see a leveling off, and this is, of course, encouraging. On to the next slide, you can see what the province presents for each of our provincial regions with regards to wastewater surveillance. The Central East region is where Peterborough Public Health fits, and you can see that we have had a plateauing, and there is still a forecast of a potential increase again, which would correspond with increasing transmission associated with relaxation of some of the public health measures, perhaps. But overall, really all of this shows a good, hopeful, optimistic picture as compared to where we were a little over a month ago, and yet it still should give us pause and reminder that the pandemic is still very much with us, and measures to protect ourselves and those around us continue to be quite important. On to our next slide, Brittany, I'm going to speak a bit about some of these topics. So I'm going to talk a bit about lowering your own risk, personal risk of COVID-19. We're going to talk about some international data and look at where public health measures have been lifted and what the impact has been. And we're going to look at the BA2 Omicron variant, which has been obviously in the news some recently. We'll do a quick review on travel guidance for those of you that may be planning travel in the upcoming weeks. And we'll also talk to the local COVID-19 tracker and some changes that will be coming for that. So in regards to our position, again, the lifting of public health measures may mean different things to different people. Some people may be obviously very pleased and happy. Some other people may be concerned. Some other people may not really know what to think. But regardless, going forward, we're now being asked to think more about assessing our own individual risks. And to make this easier, we wanted to present 3 categories of things that you should be thinking about. You, others around you, and the activity or the space that you're in. And thinking about these 3 things can help you to continue to decrease your risks in regards to the ongoing pandemic. So for you, it's important for people to think about their own personal vulnerability to severe COVID-19. We know that the vaccine has done tremendous job in terms of reducing severe disease. But some people are more vulnerable to severe disease than others. Those individuals include people who are immunocompromised, people who are medically at risk of severe COVID because of medical conditions that they may have, people who are elderly, And of course, people who haven't yet been vaccinated, either by choice or because they're not eligible yet, such as people under the age of 5. When we think about the next circle, others around you, it's important to think about what engaging with others will mean for them. And in particular, it's important to understand and be aware if others around you may have conditions or circumstances, again, like immunocompromised conditions, medical risk factors, not yet having been vaccinated or being elderly, conditions that could expose them to a higher risk of severe COVID if they did become infected. And it's important to ask and talk about comfort level around protection measures and awareness of things like vaccine, continued mask use. So being mindful of both you and others around you is important. And the last consideration is around the activity that you're engaged in or the space that you're currently in. Spaces that are less well ventilated, indoors, enclosed, will be a higher risk of transmission if somebody in that airspace does have COVID-19. We know there's an important role of airborne transmission in this pandemic, in this virus. So, as you're thinking about your own personal risks and the risks of those around you, perhaps things like not wearing your mask in different indoor settings, it's really important to be aware of, how well ventilated the space is, and whether that could potentially increase the risk of transmission of COVID-19. The other thing is being aware of certain activities that may increase the risk of transmission, such as vigorous physical activity, eating or drinking without masks on. All of those kinds of things can potentially make a space that you're in a little bit more concerning. So again, as you assess your own risk and the risk of those around you, we need people to be more aware and prepared in helping themselves to manage their ongoing risk in this pandemic. And Peterborough Public Health is going to continue to provide information and resources and materials to help you navigate these decisions and trying to make sense of risk. On to our next slide, Brittany. It's just a bit of international data to talk about the experience of COVID-19. A lot of people have looked at the Denmark experience with the lifting of measures. And Denmark certainly had a very high peak and significant number of cases. Encouragingly now, things are starting to decline in Denmark. In other settings, such as the United Kingdom, they've had higher transmission rates and perhaps even starting to increase again. But an important consideration is the mortality rate, because it's not just about infections. We know with more mild infections, that's less of a concern, but hospitalizations and deaths continue to remain important considerations. And on the next slide here, you can see countries that have relaxed some of the measures, such as Denmark, have a very high rate of mortality due to COVID-19. And this again is with lots of circulation of the virus, people who are more vulnerable, especially those who are not vaccinated, but others as well who may have immunocompromising conditions, may have medical risk factors of severe COVID, they will have a higher risk of mortality. And we know we've done really well, and it's important that we continue to protect ourselves and those around us as we continue on this pandemic, so Canada can stay with a lower level of obviously concerning outcomes like deaths. On to the next slide, Brittany. There's been a lot of questions about the Omicron BA.2 variant, and the evidence is still very much emerging on this. Several weeks ago, when this data was looked at, BA.2 was just starting to be observed in Ontario. This is what's called an area chart, and you can see by color the different variants of COVID. And at the bottom, you can see the week from the start of January 1, 2, 3 into February 5. And the pink that is emerging at the top is the emergence of the BA.2 variant. And it's relevant because it has been shown to be more transmissible. Fortunately, the vaccine still appears to be a good protection, and the severity does not appear to be more, but we're following the science very closely. And as we will need to do on the ongoing basis in this pandemic, there could be future variants that emerge that change the severity or the ability of the vaccine to protect you. So it's something we're closely watching. On to the next slide, Brittany. We've had lots of questions and wanted to provide some clarity around travel guidance. So here's an image around kids and travel with kids, depending on whether your children are under 12 or over 12, vaccinated or not, the guidance that the federal government does have in place around travel. And the rules are different depending on vaccination status. The other important consideration is that there has been lots of changes to different parts of this consideration. So at the present time, testing, return Canadians or travelers to Canada do need testing prior to travel. But the rules have changed, are changing, and what we would encourage you to do is to visit travel.gc.ca as soon before you're leaving and even while you're away to see what the latest guidance on travel is. And finally, we're going to speak to some of the changes that are coming to our local tracker. The first consideration is that as the province has changed a reporting characteristic of how they count deaths, there will be several deaths from our tracker that will be removed from very early in the pandemic that had been defined as a COVID-19 death. So you will see an adjustment in the number of deaths that we will report out, and that will be consistent with the report from the province. And that will be happening soon. On an ongoing basis, the data is, however, quite accurate, and those are from deaths that really weren't related to COVID-19 upon further assessment from earlier in the pandemic. The second piece to be aware of is that the frequency of our reporting will be changing in the upcoming weeks. We will have and share details on that once it has been decided, but with things stabilizing, we are going to decrease the number of times per week that we are updating the tracker. And when we know and have information on those details, we will communicate it. We continue to use a range of the most useful evidence, and some of that is recognizing with the changes that occurred to testing criteria, we need more information to help to make a decision. So we're going to be looking at some of our other data sources, pieces like wastewater surveillance, the rapid tests, hospitalizations, other considerations beyond our case counts, and we'll be trying to integrate some data pieces that can help people to make the most informed decision possible. But ultimately, as we go forward and into potentially future waves, if we do see them in the pandemic, what we're going to move towards is to create advice for residents based on whether or not they may have vulnerability to more severe COVID-19 illness. And we're going to have messaging and information for everyone and measures that everyone can take, but also some enhanced guidance if you're particularly concerned because yourself or those around you are more vulnerable to severe COVID-19. All of this in an effort to equip you to make the best decisions possible and protect your health as best as possible. With that, I will finish my remarks and turn it back to you, Brittany. Thank you.
Wonderful. Thank you so much, Dr. Piggott. Okay, let's hear from our elected officials who have joined us today. And I see we have MP Michelle Ferrari here with us. So I'm happy to spotlight you on the screen, Michelle. And if we have other politicians who are able to join us, we'll certainly give them an opportunity to share their comments as well. So let's go over to Michelle.
Thank you so much, Brittany, and thanks for having me. And, I think Dr. Piggott did a bang-up job of really all of the things that I would have said. I think as we move into this transition, he's exactly right. It's going to be different for everybody, and I think it's really critical that we all sort of be mindful and respectful of everybody's risk tolerance, and just keep that in mind that everybody has just been affected so differently from all of these restrictions or lifting of restrictions. So I know our office in particular has seen hundreds, thousands of emails with completely different, on different ends of the spectrums of how people have been impacted. So being really mindful and respectful of individual risk tolerance is a great message that I think Dr. Piggott delivered well. And to his other point, in terms of traveling, he took exactly what I was going to say. Things are changing so quickly, and so that travel.gc.ca is a really effective website to be looking at when you're thinking, or right before you travel, or it's a really good tool because they're updating it, and that's a big question we get asked at our office as well. And the ArriveCan app. So that website really does help with all of the questions around COVID restrictions or COVID requirements, testing requirements, vaccination requirements, as well as the ArriveCan app. So you did a great job. I really didn't have to say much, so thank you.
Wonderful. Thank you so much, Michelle. Okay, so now it's our chance to hear from our media partners. So I'll put Dr. Pigott back up on the screen, and let's start with global news, and we'll hear from Jessica Nisnik. If you've got some questions for Dr. Pigott, please go right ahead.
I do. Thank you, Brittany. Hi, Dr. Pigott. Thanks for the update. I think that reporting that some of the numbers of the deaths will change is going to alarm some people. Do we have any more information as to why that's happening?
Yeah, it's to do with how deaths are classified, and where there weren't clear characteristics of the link to COVID-19 as the main cause of death. And this was a phenomena early in the pandemic. There was some information missing, and upon gathering further information, we're just essentially rectifying the deaths. So across health units, that is being done right now as we speak. That will be forthcoming from the province in their data as well. And so Peterborough Public Health, having gone back and through some of those early deaths, are adjusting the total number that's attributable to COVID-19. It will probably change by a factor of several. We are waiting for the final confirmation, but I think it will mean that there will be approximately 3 less deaths formally counted as due to COVID-19.
Okay, that was really it for me, Dr. Pigott. I think that's just going to be the question on most of our viewers' minds, especially the conspiracy theorists. Thank you.
Thank you so much, Jessica. Okay, Matt Latour is joining us from Freakin' Oldies Radio. So if you've got some questions for Dr. Pigott, please go ahead, Matt.
Yeah, mine actually had to do with the lifting of the vaccine requirements for restaurants and people eating at restaurants. I know that if a restaurant wants to, it can still enforce a vaccine mandate for customers. And I've seen some people on social media saying, these businesses should be boycotted. Do they have any kind of supports from public health if they do continue to do this?
Well, we're answering questions and we're continuing to support as much as we can. We recognize that different businesses will put in place different requirements. Just like some businesses will say no shirt, no shoes, no service. Some businesses will make different decisions around things such as the vaccine passport. So we are obviously following provincial guidance. The required use in certain settings was lifted on March the 1st. We continue to support questions if there are any, and help businesses as they're navigating trying to make their establishment as safe as possible. And we're also helping to provide information on the broad range of measures, because certainly the proof of vaccination requirement is and has been a really important one, probably that's helped significantly through the pandemic. We know that with a 2-dose vaccine requirement, it probably wasn't actually creating a space that was all that much safer as a result of the changes that have happened through Omicron. We know that for people to be more protected against transmitting Omicron, they need a 3rd dose. The vaccine passport was only the 2-dose passport. So, I think that is understandable why that change has happened. Regardless, some establishments may feel safer maintaining that, and we definitely are supportive of businesses as they're navigating how they can operate in the safest way possible, while also giving other educational messaging about how they can protect their staff and their patrons. One of the most important things that we've been talking about with businesses is ensuring adequate ventilation, because that can dramatically change the risk of transmission in a space, especially small, poorly ventilated spaces where there can be a higher risk of transmission. So we've been providing some information and advice and support for a while now to businesses on that. And we'll continue to be here and support them in whatever ways that we can as they're navigating this changing time.
That's it for me. Thank you.
Great, thank you, Matt. Okay, Paul Rellinger is joining us from Kawartha now. Thanks for being here, Paul. Go ahead if you've got some questions for Dr. Pigott.
Thanks so much, Brittany. Hi, Dr. Pigott. How are you? Just a couple of things. When we look at the outbreaks, Fairhaven's really struggling right now, staff and residents. There are quite a few people have COVID, and that's the result of the outbreak. What's the particular situation there? Have you been kind of watching that a little more closely? Because you're right, the outbreak picture has improved, but yet this is hanging out there.
Yeah, thanks, Paul. And I don't think it's my place to comment specifically on the more private details of any of our outbreaks in that regard. We know that sometimes they will continue longer, especially because there's so much COVID-19 transmitting in the community. But what we're doing is we're helping to support, we're working especially around infection prevention and control measures in all of our outbreak settings, and helping to support as best as we can to try to bring those outbreaks to a close. But in the context that we're in now with COVID-19 and continued introduction, if people are exposed from somebody outside or staff are coming in with the infection, it is a challenge, and we are seeing some outbreaks lasting longer as a result.
Thank you for that. Wanted to ask you about the expected lifting of the masking requirement. Doug Ford has indicated that may happen sooner than later. I know you said earlier about personal choices for people and how they have to do what they feel comfortable doing. But I think, as well as many do, once the green light is given to take those masks off, many will do just that. How concerned are you? Is it time? Is it too soon? What are your thoughts?
Yeah, thanks, Paul. I think masks are and have been a great life-saving strategy in this pandemic. They're probably the second most effective tool we've had in the toolbox against COVID-19 after vaccination, and they continue to be really helpful. We, as recently as last week, heard from the province, from the Chief Medical Officer of Health, that continued masking is an important strategy and part of their strategy on a go-forward basis. So I certainly hope that will continue to remain true, and that masking will continue to be required in some settings where that is a risk. We will continue to provide recommendations at a local level around masking, but obviously we await with interest the decisions that are ultimately made by government.
Thank you. And just one more thing, Dr. Pigott, if I may. Throughout the course of the pandemic, we heard the word endemic come up many times about getting to that stage and what that would mean. With the province lifting requirements, it seems with greater regularity and promising to do more. Are we at or near that endemic stage, or how? I guess I'm just looking for your definition of where we need to be in order to say, yeah, we're in an endemic.
Yeah, thanks, Paul. There's been a lot of focus on that, and I think it's probably not the best place to focus, because endemic doesn't mean not dangerous. Endemic means stable. There are stable infections such as tuberculosis, for instance, which is after COVID-19 the second leading killer of people worldwide. Nearly 500,000 people die from tuberculosis every year, and have for over 2,000, 3,000 years, as long as tuberculosis has been around with us. So endemic diseases are not innocuous. They can still be dangerous, and they can still require us to have significant public health response and measures to prevent and treat. The other thing that I would say about endemic and the definition of stable is that it requires looking in the rear view mirror, and it's tough when we've been through these significant roller coaster waves of the pandemic to date to say anything about a stabilization in the rear view mirror yet. So I think I'm obviously hopefully optimistic of where we are. I'm very encouraged. I think we are in a good position, but remaining vigilant, and especially for those who are more vulnerable in our communities, understanding that this, even if COVID-19 does continue to transmit and be stable, can still pose a significant burden on people, on families, and on our communities.
Thank you. And again, I lied. Just one more thing. For all the different stages we've seen in this pandemic, different outbreaks, periods where things weren't so bad, is this the best you've felt during the course of the pandemic, just in terms of the overall picture?
No, I wouldn't say so, because I continue to be concerned by the high level of transmission that we're seeing. So certainly with a more mild Omicron and all of the benefits we've had from vaccination now, we're in a good position. I mean, when the pandemic first started, I, like a lot of people, thought we'd be in this for a few months and be out of it. So I think that what, now 2+ years of this pandemic have taught me is to stay humble and to be, attuned to the changing evidence and changing context, because things can and more than likely will continue to change. So as much as we're in this journey of learning to live with this, as much as we're seeing, relaxation of measures that have had a tough consequence, and it's not the consequences of those measures, it's the harms of this pandemic, right? We've had life-saving measures in place, but this pandemic has been extremely hard. I think I'm optimistic, but I think that we need to really remain vigilant as we go forward.
Thank you for that, Dr. Pigott, and thank you for clarifying the endemic question, because I think it's important, and I know you do too. Thank you, Dr. Pigott. Thank you, Brittany.
Okay, great. Thank you, Paul. All right, Bill Hodgins is here with us from Mike Ortha and Peterborough Examiner. So go ahead, Bill, if you've got some questions.
Sure, and I'm sorry if this is kind of rambling because I wasn't quite sure how to ask it. You say we're in a better place, and I think people are seeing that. Nobody's saying the pandemic's over or ending or anything, but just around the health unit, around the people you work with, is there do you see a winding down beginning to happen where you can maybe focus on some pre-pandemic issues yet, or is it still, I guess, the major obstacle for the health unit right now?
No, Bill, I think there have been some good changes. For instance, in the last couple of months, we've been able to do a lot of focus on the drug poisoning crisis, opioids that are impacting our community, and we're starting to resume and recover some of the services that we've had on pause that have been sorely missed during the pandemic. So what we're trying to do is maintain the COVID response elements we need to, and maintain readiness if things get worse again. But we know it's really critical to get back to some of our broader work, and folks here will know the nature of that work. But it's a whole range of things, from trying to help improve health of kids in schools, health of communities through nutrition and food security, ensuring safe environments through our environmental health work, our broad policy work around some of the social determinants of health. There's so much work that we do in public health, and we're excited to be getting back to some of that, while obviously maintaining readiness and capacity to continue to respond to this pandemic, because that's also really important. Okay,
and I guess just as a follow, will we be seeing, I guess, less of a presence of the vaccination clinics? What will be the process for getting a vaccination, say, a month or two from now?
Well, we're going to be maintaining access. We think it's really important. Some people take longer to decide that they want the vaccine. We've had tons of availability for weeks now, so most of the people that have really wanted the vaccine to date have gotten it. But we're going to maintain access. It may look a little bit different. It may be at a different site and location going into the future. We always wax and wane our staffing and capacity depending on demand, so that we're being responsive and appropriately measured. There may be a lot of work to do with potentially different doses into the future of this vaccine. And we know a whole component of the population still, the under 5s, haven't had their chance yet. So there is a lot of work we continue to do in the vaccination program and will do into the future. But of course, all of that's in response to the needs and the demands in our community, and will continue to be measured around that.
All right, thanks. That's good for me.
Thanks, Bill.
Great, thank you, Bill. Okay, any follow-up questions, Reg? Reg Watson is here today too.
I'll just try to ask, do you expect Peterburghers to reopen? And if so, what steps will the health unit take to ensure that the Ontario guidelines that are still in effect are maintained there if they do reopen?
I can't speak to intentions. Certainly the matters of the court case that you're referring to are in the public domain, and Peterborough Public Health's been working with that particular establishment, supporting in a collaborative way for a prolonged period of time. Many of our other enforcement related issues have obviously had an easier, better resolution as we support people to making their services comply with the provincial regulations. So we'll continue to do that work, and however relevant, but I'm not aware of anything at this point.
Okay, thank you.
Okay, great. Oh, that's everything, Reg? Okay.
Yes.
Okay, great. Thank you. All right. Well, thank you so much to our media partners and to Dr. Pigott. And that does bring us to a close today. Before we leave, I do want to announce a change to our briefing plans. So we are transitioning our briefing communications with the media from the regular biweekly schedule to an as-needed basis. So today's presser is the last of our planned media events. However, should anything change requiring urgent communications regarding COVID or other public health matters, you can rest assured we will hold a dedicated media briefing. And this change also aligns with the Chief Medical Officer of Health, who will also be standing down his regular briefings to the media next week on March 10th. So I just want to thank everybody here for joining us over the last 2 years. Together, we have completed over 108 briefings since the first one on March 16th, 2020. We're grateful to our media partners for their important role providing credible health information to our residents. And thank you also to our board chair, who has been a stalwart participant in these events, as well as our elected officials who've stood by us during these briefings to help residents navigate the pandemic. So thank you very much. We will send a media advisory the next time we are holding a press conference like this, and do take care and stay well out there. Thank you. Bye-bye.
Thank you.
Thank you, everyone.